Right.
Hello, I'm Dr. Bittiker. I'm back to give you another presentation on one of our other causes. In this particular time, we're going to be doing the adrenal pause. We've covered the cardio pause, which was the heart, the brain pause, and other pauses. Now we're going to be covering the adrenal pause. Now, the adrenal gland is a little gland that sits on top of your kidneys. It has two parts. Not going to go into the technical details about the distinction between the anatomy, but actually part of the adrenal gland is very interesting. It actually resembles part of your brain. Actually, brain tissue sitting right on top of your kidneys there. You wonder, why would you have a part of your brain down there? Well, it regulates a lot of activities of the body. It's kind of known as the stress gland. I'm not talking so much about the actual diseases as maybe syndromes or symptoms related to adrenal exhaustion. Now, there are those people that will tell you that there's no such thing as adrenal exhaustion, that it's like a made-up disease or made-up condition. Well, the problem with that is they haven't bothered to study the research. I might refer them to some research done by Hans Selye back in the 70s and 80s, where he induced adrenal exhaustion in animals by stressing them out, loud noises, coldness and things like that. And you can stress out animals, and in a period of time they go through the very same stages that we humans go through, which is they go through an adaptation stage, then a change stage, and then they finally get to the point of exhaustion. And in exhaustion, they die. That's right. Their hearts quit, or something else bad happens, their immune system goes down, they get an infection, but some terrible things can happen. Well, like a lot of other conditions, there's a kind of a gradation between whether you have the disease or whether you don't. In an earlier pause, we mentioned about a thyroid. There's a thing called subclinical hypothyroidism, where you have say somebody whose labs or their symptoms are not exactly 100% that of hypothyroidism, and yet they do have a modified form. Is it bad enough to treat them with a drug? No, it's not. But do they have some symptoms related to it? Yes, they do. So the truth of the matter is the degradation or the change between having a disease or not is not always black and white. It's not always a clearly drawn line. A lot of times it's gray. So that's what happens here with hypoadrenalism or adrenal exhaustion. Now, there's two major conditions related with the adrenal. One is called Addison's disease. That's where the adrenal glands are too low, the activity is too little. There is Cushing's disease, where the adrenal glands are too high, too much activity. That shows up in people in the form of maybe a bloated face, discoloration of the body, large upper body, spindly legs, and a whole bunch of other conditions. We're not talking so much about hyperadrenal activity, which can result from stress, because the reaction of the body to stress is initially to increase the secretions of the adrenal gland, and then once it exhausts, then it begins to decrease and go into hypoadrenalism. So that can be the initial response, but not usually to the point of getting Cushing's. So we're talking more about hypoadrenalism here. Now, what are the symptoms of hypoadrenalism? Well, some of them are and the people that criticize adrenal exhaustion diagnosis, they have a point. The reason being is that the symptoms of adrenal exhaustion or hypoadrenalism, they resemble a lot of other conditions, and so they can be misdiagnosed frequently, and very often they are, because they can imitate a lot of things. For instance, fatigue is one of the big things you'll see with adrenal exhaustion. Well, that can be caused from dozens of other things. Also, hypoglycemia, low blood sugar. Again, same thing caused from other conditions. Even high blood sugar, diabetes can be related to the adrenal activity. Some of the more common symptoms that we get with people that are definitely related. For instance, if you're one of those people that when you stand up very quickly after lying down or sitting down, you get a little faint, there's a good chance you've got an adrenal insufficiency there. There's also a chance if you have some bronzing changes or discoloration in your legs and feet, that can be an indication too. But let me tell you some other ones that are not so commonly thought of as being related to hypoadrenalism or decreased adrenal function. One of them is asthma, bronchitis, or chronic cough. You wouldn't think they are, but they have a lot to do with the fact that one of the functions of the adrenal gland is to secrete your anti-inflammatories, like your cortisols, your epinephrines and norepinephrines and things like that. That's one of the functions of it. It also secretes what are called mineralocorticoids, which have a lot to do with the mobilization of your electrolytes and or minerals in the body. So, for instance, if you have a craving for salt or sweets, you may have adrenal insufficiency, or it may be something else, but that's not an uncommon thing. A lot of times we find out that allergies can be related to adrenal insufficiency too, because again, you may be prone to inflammation and your body can't secrete enough of the anti-inflammatory hormones such as cortisol and others, and therefore you get allergies and or asthma. Recurrent infections, that has a lot to do with it. Muscle weakness and back pain, A lot of times, I experience this as a chiropractor. I have patients with back pain, and we'll find out that they also have an adrenal insufficiency resulting in not mobilizing the minerals correctly to get them into the ligaments and to the bones to make them strong, and you end up with a patient with a lot of pain. There are some other symptoms that we see here in people very commonly. The sleep disturbances. Now, this is kind of a two-edged sword. I'm not sure whether the sleep disturbances occur first, resulting in adrenal fatigue, or the adrenal fatigue causes sleep disturbances, because it can go both ways. Dizziness, this is the big one, as distinguished from vertigo. That's positional vertigo. And this is the one position. In fact, one of the tests we use in our clinic to diagnose hypoadrenalism, or adrenal insufficiency, I'll put it that way, is we lie the patient down, let them equilibrate for a minute or two, take their blood pressure, whatever it happens to be, and then we have the patient stand up and take their blood pressure again very quickly. Now, don't try this at home, because if you faint or pass out, we're prepared to handle that here. We have a way of, our patients don't faint or pass out, we hold on to them. But anyway, so if you faint or pass out, you're taking a chance yourself if you do that. So don't do it. But we'll take the blood pressure. Now, normally your blood pressure should go up because you're standing up. Your heart should have to pump harder to pump blood up to your brain. That's normal. Or your pulse rate should also go up. That's a normal physiological response. But if you don't get that, then your adrenal glands are not functioning like they should be. In fact, have you ever seen these soldiers that pass out in the middle of a parade? That's because they have hypoadrenalism. Their blood pressure drops too low to keep the brain oxygenated properly, and they pass out. Also, another thing we see is we'll put the patient in a darkened room, and we'll shine a light in their eye after they've equilibrated, let the pupil dilate, and we'll shine a light in their eye. Now, the normal pupil should constrict fairly quickly because it dilates in dark light, no light, and constricts in light. Okay, but when it does it, it should do it all at once fairly equally, but it shouldn't do one of these things, like it constricts and dilates and constricts and dilates. That's called Ragland's sign. Again, that's a pathognomonic for adrenal insufficiency. Very indicative of it. Some other indicators are generalized inflammation. You got arthritis, problems like that. Could be nothing more than the fact that your adrenal glands may be depleted. It could be a lot of other things too. I mentioned hypoglycemia. Headaches are a common thing. Behavior and memory problems. You wouldn't think there's a lot to do with it, because the sleep disorders actually cause brain deterioration, and sleep disorders can be caused by adrenal insufficiency that can result in damage to the brain. I mentioned salt cravings, excessive thirst, and urination. In fact, if you're getting too much activity of the low aldosterone, you may urinate 15 to 20 times a day. That may not be diabetes. It may be your adrenal glands working incorrectly. Another common side effect from hypoadrenalism is swelling in the ankles. I know it can come from the heart, it can come from the kidneys, but it can also an overconsumption of salt. But if you're accumulating sodium, that means the mineralocorticoids are not being secreted properly to get it out of your body. So again, that can be back to the adrenal activity there. So swollen ankles can also be an adrenal insufficiency problem too. Varicose veins, definitely an indicator, particularly the little spider veins in your legs, in your ankle area, but also hemorrhoids. Very common association with hemorrhoids and adrenal insufficiency. There's another thing about heart sounds, about the first and second heart sounds, and I'm not going to go into that, but there's even a difference in the way things sound there. So that's typically what we'll